Good evening, everyone. Today is the 7th of February and a very special day. As you know, it's Wednesday, and a special note for today. We have two special guests and our guest speakers today. Welcome, Jayshree. Welcome, Hema. How are you both doing?
Doing good,
Doing
thank you.
good, Pramila. Thank you.
The topic for today that you're going to speak about is NPD, Narcissistic Personality Disorder. With so many of our callers calling us, often they have mentioned this word, and I'm sure our audiences who are listening today on Facebook Live, YouTube, and Instagram have a question. What is it? Does it mean? And what are symptoms to look for anyone exhibiting NPD? So, Jayshree, Hema, it's all yours.
So, who is a narcissist is the first question that arises. So, it is anyone who has a inflated self importance. It's a very inflated sense of self importance. It's all about I, me, myself, my comforts, and they have a very fragile ego. And they really don't care about what happens to people around them. It's all about themselves. What do you say, Hema?
Absolutely. A narcissist is defined by the four pillars of narcissism. Narcissism. He has lack of empathy, meaning it's all about himself or herself. They don't care about the others. They don't want to show that empathy towards others. Grandiosity. Um, Everything about them should be rich or big or elevated always. A chronic sense of entitlement for them, and then chronic need to seek out admiration. They have to be always praised. They want to always feel special, which is definitely a personality disorder. That's really the core of that disorder. And sometimes people don't even know that they are around a narcissist because they come in so many different flavors. Um, in fact, a recent study by one of the doctors that I will introduce in towards the later part of this program, he says that it's actually a spectrum of self-importance that we all fall in. Like somebody can be utterly selfless, and on the other extreme, they can be so arrogant, which means we can either be a true narcissist or we can just be a jerk, that kind of a person. So it is we definitely need a lot of understanding of that personality in order to like spot a narcissist.
Yeah. And one thing that I have noticed amongst the callers to Sanjeevani is they say that he is all normal when we are outside in public with friends in the society. I'm saying him because this exists between men and women, but for some reason, it is predominantly amongst men. That's what studies say. Why is it so? We don't know. But to an outsider, they don't, an outsider cannot spot a narcissist. Only the person who lives with him or who comes in close contact with him, like in an office environment, it could be somebody who is working under him. So if the boss is a narcissist, somebody who is working right under him would know, but nobody else would know, because they kind of pick and choose their victim who is dependent on them. In a family environment, it could be anybody, like it could be the wife, the daughter, the mother. So they, if somebody is a little weak in any which way in comparison to them, according to them in their head, they pick their victims like that. And the victim can recognize the personality when they go through these stuff. Total control. So a few of our callers have told that he doesn't want me to talk to my friends. He wants me to cut off from my family. So this is one typical character of a narcissist who wants to isolate their victim. Have you
Mm.
a
Yeah,
similar? experience from your callers?
Yes, yes. Most of the times it has been women. That is something that I have observed too. Um, Women are the victims or sufferers, and the behavior is so prevalent. They are so used to it. At one point in time, they just accept that it is the personality of that other person, and it's hard to change them, or they are so used to living with them. And you
And
brought out a good point. The narcissist can be at a workplace also. We can find excessive narcissism, um, where it is required that there needs to be some degree of the drive to feel special, because it is required to maintain a healthy sense of self-worth, but it is so intermingled in their personality that it is very hard to distinguish an extreme narcissist from one who is actually having that just enough drive to feel special and be able to perform their work. So that is a good point. At workplace, at home, these personalities are so intermingled. It is hard for the victim to really distinguish between that extreme narcissism and maybe, and only if they understand and know that they are being victimized, can they be able to think about coping strategies,
right.
um, and dealing with a life like that.
So, what I have seen, another thing common amongst at least two or three of the callers is they say that, no, it's me. He is all fine. It's me. I do this, and so he gets angry. I, overslept today, and so he was mad. I should not have overslept. So, this is a pattern. They want to make the victim feel guilty for anything and everything and blame the victim. So, the victim is not able to understand what actually is happening. Am I behaving like this, or is it his behavior that is making me behave like this? They are totally confused, and they do not know whether to stay in the marriage or get out. This
Oh,
is
very true.
one common personality, I mean, common trait of the narcissist.
Very true. Such a strange coincidence that I had a caller that used to that actually became habitually a self blamer for anything and everything that goes wrong in the family. She thinks she could have been better, she
She's
could
the
have
cause.
handled it better. uh, and it's the effect of living with a narcissist that she becomes so self-critical, so inadequate. She has been belittled so much. I also tend to say she because it unfortunately happens to be the woman in most of the cases. But there are also men that suffer from this narcissistic behavior of
Women.
a woman. But
Women.
most of the times, because we just happen to deal with a lot of women in these cases that are victimized, it's the exact same behavior that I have seen. Even after so many years of being married, it is hard for her to accept that it is a personality disorder that she's dealing with, not just a normal human being. So that actually gives me a good segue into the books that I wanted to introduce to the listeners today.
Yeah, please do.
Okay, okay. So one of the things that we wanted to do is introduce Dr. Ramani. Dr. Ramani Durvasula. She is a licensed clinical psychologist. She is featured in many TV networks. She's an expert on the impact of toxic narcissism. Professor of psychology at California State University, Los Angeles. That's it's, she is on Instagram, YouTube. She has a lot of online presence. Anybody can look into her website, drramani.com, and listen to her podcasts. There are two books that I really liked about this topic, which is Take Your Life Back, which is already published, and the other one, which is coming in February, called It's Not You, which explains the exact scenarios that we have been presented in those scholars that call us. So this both the books, they provide the help needed with healing and thriving after or even during a narcissistic relationship. it's a very challenging life that these victims go through, and I think it'll be of great help if they were able to get access to these books, read them. And there is another doctor called Craig Malkin. He is also an expert, and has like decades of experience in dealing with couples and their relationships. He has this work called Rethinking Narcissism. So it's a book, and he uses a tool called Narcissist Test, and that is that helps us measure the range of narcissists that we actually are. So anybody that takes the test can understand
To what
how
level they are.
deviated or how normal they are. It's a great tool. I just realized this can be a great tool for people that really don't feel special in their relationships, or they're just not living their lives. Um, um, where- I mean, their well-being is challenged. Then I think it's a great tool that they can use. Hello, are you there?
Yeah, great insights, Hema. We're also waiting to hear from Jayashree. So, narcissist personality disorder definitely, it is cause of concerns. So, Jayashree, what are your thoughts on what Hema shared?
Sorry, I got cut off a little bit. I'm back again online. So yes, I agree and understand. And you said a person should take the test about the writer you mentioned. But will a narcissist admit that he is one and take the test? That's the question. No narcissist will admit that he is one, because they are always blaming the victim for everything, and they mess up with the minds of their victims. So much so that the victim believes that there is something wrong with them, and that is where family issues start. And it's not only the victim who needs to understand and identify the narcissist, but it's his and her family as well.
Very true. I think the tool is meant for couples that come into a therapy session knowing that something is not going very well, and way before the term narcissism is introduced in that relationship is when I think these tests will help them. Um, but yeah, it's a good question. No narcissist really admits to the fact that there is something deficient about their disorder,
Because
and
they're the superhumans.
of course,
And in their head, they are the superhumans, and they can never commit a mistake. They are holier than thou. They have that mentality. And again, one thing that we see is the earlier you detect this personality or anything, the earlier you get the treatment, the better it is.
yes.
But this is something that sets in during early childhood or teenage. And by the time they kind of have their victim have control over them, it's too late. Their stage of disorder has been advanced. And then comes the main question of will they admit it? So sorry to say this, but I see little help that, little that they will change. So it has to be the victim who needs to understand this and work around the situation to free themselves from the situation they live in.
That is right. Because anxiety or depression or that kind of disorders can be helped a little bit with medication and therapy. But this is a personality disorder which cannot be treated using any internal medicine, unfortunately. And only therapy, in fact, talk therapy can help. The path to recovery is only in the path to recovery is only via talk and a motivated mind of the narcissist himself. Of course, yeah.
So yeah, so one thing that I have noticed again with the callers, like we give them some ideas, like, if he is doing this, then why don't you try this method to make him understand? So there have been cases where the narcissist goes to the next level and cuts off the victim from any contact with the outside world. Take away the phone, take away the laptop, so that they are not able to connect with us. So the control goes up to this level or even more. So it's a very narrow passage that the victim has to go through to get out, but it's not impossible, is what I want to tell our callers, whoever might be watching this and might be in the similar situation. It is difficult, but it is not impossible. You if you can try to be a step ahead of the narcissist, you can still get out of your situation. So
True, agree to that.
Jayashri, one question has come. You mentioned about treatment. So, and Hema, you mentioned that psychotherapy, talk therapy is one way, or a motivated mind to understand something is not right with me and I need to make a change. So, if someone has identified himself or herself to be one, is the recommendation they see a psychologist, a therapist?
both a therapist to talk to and get out, and a psychologist. And if there is any medication needed, then they will have to take that. But definitely, therapy will help. The mind to change themselves is the first step to recovery, and that will definitely help. What do you say, Hema?
Absolutely. There are co-occurring disorders. So a narcissistic person may not just be too like just be a narcissist. He could be something also. There could be underlying disorders that may be causing this could be one of the symptoms of an underlying depression. So that needs to be treated with the psychologist's help, while this personality disorder itself should be dealt with using therapy and counseling.
And to our callers again, one thing that they can use to keep peace in the house is not playing into their games, and being steady in their mind that this is what he's trying to make me believe, but this is not true. I am fine. Nothing is wrong with me. I did not make a mistake. He thinks it's a mistake, yes, but nothing is wrong with me. This will help the victims maintain their mental stability to certain extent, un- until they are ready to get out of that or completely heal the situation.
To everyone watching or who plan to watch, if you know someone who may be going through and living with a person as this, could be male, could be female, could be of any age, and if you have more questions, please reach out to Sanjeevani at 224-424-0050 for any questions that they may have or any additional information that we can provide. Thank you so much, Jayashri. Thank you, Hema. I think it was a very productive and very informative session. A lot of people, they want to know, but for various reasons they are hesitant to ask, am I that person? Am I dealing with such a person? And what help is there? So appreciate all the information that both of you have shared.
Thank you.
Thank you. Thank you for the platform,
Thank
and
you.
thank you, Jayashree and
Yeah,
Pramila.
platform, Pramila.